So most of the malaria burden is in sub-Saharan Africa. In fact, 11 countries in sub-Saharan Africa account for over 60% of the malaria burden. So it really is significant. Also, the most affected populations are children under 5 and pregnant women. So some of the most vulnerable people in the world.
What kind of consequences have this population with malaria?
So one of the sad consequences of malaria is mortality. One child dies every minute from malaria, and 600,000 people are killed by malaria every year. So that's a very high mortality rate. Therefore, dealing with malaria is really important for the economic development of Africa. It's estimated that something like $4 trillion of economic gains could be made, especially in some of the poorest countries in the world, if we were able to eradicate malaria by 2030.
What has been the Global Fund major contribution to fight malaria nowadays, and what are the next objective goals in the near future?
So the Global Fund is one of the most significant funders of international financing for the fight against malaria in the world. We account for 65% of funding for malaria interventions in the poorest countries in the world. And that has resulted in a reduction of the mortality rates from malaria of 28% since 2002. So we've had a significant impact on malaria, with a lot of infections having been prevented as well. So that's a really important factor, both in the ability of children to go to school and in people to be able to go to work. So the impact has been significant. But we're very concerned that increasing resistance to both the insecticide-treated bed nets and the treatments available for malaria are making it very, very difficult for us to continue this fight. So we need to make sure that the resistance to artemisinin-based treatments is dealt with, and that new bed nets with different insecticides are implemented as a way to mitigate the challenges we're seeing in malaria.
Actually, the main tools to fight malaria are vaccines. What about in these countries, about the access to vaccines?
Well, vaccines would be a new tool to fight malaria. So in fact, the impact that we've been able to have on malaria is really by using a combination of all the existing tools. We very much welcome the vaccines as new tools to add to the arsenal with which we fight malaria. And the 2 new vaccines are going to hopefully contribute to the ability to stop mortality and morbidity from malaria. What we're not sure of yet is what the combination of these tools will have as an impact. We very much hope that the vaccines will provide significant protection. And those new vaccines have yet to be rolled out. They've just started to be rolled out by our sister agency, Gavi, who's helping to support countries to do that. But for us, it's very important that the existing tools, insecticide-treated bed nets, seasonal malaria, chemo prevention for under 5s, and the environmental factors such as indoor residual spraying continue as we roll out the new vaccines.
2 important questions. You, in part, you already said it. Drug resistance is a great problem over all the world, especially in Italy. What do you think to do with Global Fund to counteract this problem?
So one of the activities the Global Fund undertakes is to make sure that there is real quality control of the drugs that are being provided and that they are correctly administered. So one of the things the Global Fund supports is correct diagnostics, so that the drugs are provided only when malaria has been diagnosed. So testing is really important, and that the quality of the drugs is also assured. So one of the interventions we do is to make sure that drug quality control and surveillance is maintained in the countries where we fund, so that only high quality certified drugs are provided as part of our programs.
Another important question is the impact of climate change on the infectious disease. What about these items, and do you have some data about the connection between climate change and infectious disease?
So the nexus between climate and health is a really important area for study and surveillance. What we're seeing as the impact on the infectious diseases that the Global Fund treats is that there are two major aspects that we're worried about. The first is the changing nature of the infectious diseases because of the changing nature of the effects on climate. So where you have areas where that are hotter than they used to be, we're seeing, for example, mosquitoes at higher elevations than they were normally seen, or in areas of countries where malaria was not endemic, are now seeing outbreaks of malaria. So what you're seeing is a change in the disease pattern because of the change in weather patterns. So that is something that we're tracking with our partner countries to see exactly what is changing with the epidemiology of the disease. Secondly, what we're seeing is because of extreme weather events, we're having to adapt very, very quickly to change the nature of our programming. So whether that's making sure that medicines and other tools are stored in places that are climate resilient. So if there are storms or floods, the warehouses are protected and are resilient to those changes. And we're also trying to adapt the way in which our tools are rolled out during the year, because the seasons are changing. So we have to be much more flexible in the way in which bed net distribution is done, for example, or when seasonal malaria chemoprevention is provided, if the malaria season is starting earlier or later than it used to. So all of those changes are meaning that we have to be very flexible and very vigilant in what the impact is on these diseases.
I read about the project of new mosquito nets that are very effective against malaria. In recent months, cases of dengue have been sharply increasing, especially in Brazil, Argentina, and these days also in Italy. Are there any data on dengue cases in Africa? And do you think that could these mosquito nets also be developed or useful for dengue? I don't know. You don't know. I can imagine, but the technology behind this concept, in your opinion, should be useful also for other pathologies like dengue, because we are also talking about mosquitoes.
Yes, so one of the things that we're financing as we roll out these new dual insecticide treated bed nets, which we're very excited about because they're much more effective in controlling malaria infected malarial mosquitoes, is that we're investing in a lot of surveillance and evidence gathering so that we have a lot more data to see exactly how effective those new insecticide bed nets are, and monitoring the research to see how well those are contained. Given the rapidly changing patterns, not only of the climate-affected areas of malaria, but also the new mosquitoes that have been moving across the Sahel, a lot more surveillance is required and a lot more research is required so that we can see exactly how effective our new tools are.
Yeah. On the occasion of the World Malaria Day, what key messages do you like to send to our readers to raise awareness, first of all, and also commitment of the global community against the malaria, because in Italy we don't have malaria, rather than imported cases from people traveling abroad. So the awareness is very low.
Malaria affects, as we've said, some of the most vulnerable people in the world, children under 5, and pregnant women. So the fight against malaria is really important to protect those very vulnerable and, in fact, the future. So we believe that we have tools that are extremely effective against malaria. We're excited about some of the new tools, but we've already had an incredible impact, including declaring several countries malaria-free over the last decades of the fight against malaria. And we need to double down now to make sure that we can still meet those 2030 development goals to control malaria and to make sure that we don't have additional resistance or additional challenges with the tools that we're introducing. We're very excited that we now have more tools in our arsenal, both the dual insecticide-treated bed nets and the vaccine, but all of these things need to be implemented together if we're to have impact. This is one of the things where we have the tools to make a difference, where we can save the lives of under 5s. So we need to make sure that we continue that fight and protect those most vulnerable in the poorest countries in the world.